Thanks, and I'd like to thank the public speakers as well. That was very moving. Next slide, please. So next we'll hear from the public comments subcommittee. These are the subcommittee members. Holiday, myself, Jennifer Platt, Gabriella Zollner, and Lauren Overman, who will be doing today's presentation. Next slide, and I'll turn it over to Lauren.
Good morning. Thank you, Dr. Hu, for that introduction. I appreciate it. I'm here to talk about a content analysis that we provided as part of the public health comment subcommittee to summarize and try to edify the committee members on the comments that we received. So next slide. And go ahead, next slide. So this content analysis was first addressed by the co-chairs of the public comment subcommittee for this cycle, Dr. Hu and Holiday Goudreau. And this will help inform not only the committee, but also the full tick-borne disease working group and the subsequent report to Congress. And this was also pursued because we wanted to find both qualitative and quantitative elements to better understand what people were writing in about and how it could be incorporated in our report to Congress. So go ahead, next slide. So between November 2017 and December 2021, the Tick-Borne Disease Working Group received at least 1,371 emails and 459 public comments, all of which are available on our website. And of those, about 75% of those were emails that we received, and about 25% were commentary. We incorporated both of these emails and comments in the content analysis that you'll see today. There were some limitations on that, and we'll discuss that in a later slide. So next slide. So this content analysis, it is a qualitative analysis that is designed to better understand the sentiment or to better define a research question or problem. It, as I said earlier, is composed of both the emails and the public comments, and it excludes the verbal comments that we've received. So we've had a number of verbal commenters over all 3 cycles of the Tick-Borne Disease Working Group. But those verbal comments, we don't have in written form in all cases, so we did not include those. And we did this by going through every single email and comment, and we identified qualitative themes, and we coded all of those, and that was designed to better understand the prevalence of certain themes. So go ahead, next slide. We used NVivo version 12 by QSR International to do all the coding. It was conducted by a single researcher, but the work of both Alison Petkov and my former colleague, Debbie Seam, was essential because they were instrumental in organizing and categorizing all of those commentary. We did some case coding for every topic or disease or condition. So if somebody wrote in about 3 themes, for example, we coded those all separately. And then we used Tableau and Microsoft Excel to put those in graphical form. Next slide. As I said before, this was done by a single researcher. There was quite a bit of redaction required, part of our FACA rules. We didn't want to identify people who did not wish to be identified publicly, so we weren't always able to include certain elements of that. We also had some difficulty in identifying the exact number of unique emails. And then I just wanted to mention that this was the 3rd cycle, but we are only halfway through the 3rd cycle. So the majority of comments reflect the 1st and 2nd cycles of the Tick-Borne Disease Working Group. So go ahead, next slide. So proportions, we received a significant portion of our emails and comments about Borrelia, Lyme disease. And the vast majority of that was Borrelia burgdorferi, although we did see a minority of comments about Miyamotoi and other Borrelias. The next largest category or proportion that we received was in the general field of tick-borne disease. So this could be something that people don't discuss about mitigating efforts for all tick-borne disease. It could be talking about tick-borne ecology, or just generally efforts to increase resources to better research and identify tick-borne diseases. The next largest category that we received was alpha-gal syndrome. This was primarily within the 2nd cycle. And then following that, we had Babesia, Bartonella, and rickettsial diseases. Go ahead, next slide. Within this, we identified 6 different categories in addition to the FACA business. And then within those, we coded for a number of different nodes. So this includes a representation of all of the different nodes that we coded for so that we could better identify themes within the emails and comments. Next slide. So we separated those into challenges, epidemiology, ethics, morbidity and mortality, patient experience, resources, and then FACA business was primarily emails dealing with either transparency or nominations to the tick-borne disease working group. Next slide. So within the major themes of infection and disease, the 5 largest categories, we had a number of themes that kind of rose to prominence within them. With Borrelia, we had protracted treatment or chronicity as a major theme. We also had delayed diagnosis and misdiagnosis. So a number of these emails that were addressing Lyme disease also addressed these themes. Within tick-borne diseases, regard, delayed diagnosis, and research were major themes that came up. Alpha-gal, overwhelmingly misdiagnosis was a significant theme, but we also had commenters discuss feeling disregarded and the lack of clinical education as themes. And then Babesia, protracted treatment and chronicity, again, often in concert with Lyme disease or Borrelia. A number of commenters referred to Lyme disease and other co-infections, but didn't always separate those two when discussing them. And again, delayed diagnosis and feeling disregarded also was significant in those emails. And then rickettsial diseases, delayed diagnosis was a significant theme among these. Diagnostic criteria, which also was prevalent among all of the categories, and then patients feeling disregarded again came up. So go ahead, next slide. So among the themes, we are going to identify a number of the themes that we received. Feeling disregarded was a significant theme among a lot of these comments. Patients said that they felt that they were being disregarded, that clinical providers didn't listen to their symptoms, that they told them that it couldn't possibly be a tick-borne disease, or they said that it's not possible in their region because they're not in a non-endemic area, or maybe they feel dismissed or their symptoms weren't recorded properly. So a lot of patients feel as though they didn't get a proper assessment of their condition and felt as though it was difficult to discuss this with medical providers. Go ahead, next slide. Diagnostic criteria was also a theme that we saw fairly prevalently among all of our disease infections and conditions. People feel as though the surveillance case definition is being applied to a clinical context inappropriately. They feel as though, especially for providers that have not dealt with tick-borne disease routinely, or that they don't understand maybe the tick-borne disease that the patient is being diagnosed with, they felt as though sometimes this patient was not, like their symptoms were not being taken into account. And maybe if they didn't meet the surveillance case definition, the provider wouldn't seek to identify other aspects of their disease or condition. And this was a significant source of frustration among people who commented. Next slide. Geography was another big one too. And I think I mentioned earlier, but sometimes when we see the word Lyme disease, that actually accounts for Lyme disease and other conditions in certain circumstances when it's not specifically acknowledged. But we had a number of commenters that discussed either traveling to endemic areas or living in endemic areas or serving in the military in endemic areas. But when they moved home or moved away from those areas, clinicians wouldn't acknowledge that this could be within the differential. So we have people from a significant portion of states that said Lyme disease doesn't exist here, or you can't have Lyme disease because you don't live in an endemic area. Go ahead, next slide. Patient experience. This is a big one that kind of spanned a number of the nodes that we coded for. So people who have been diagnosed with tick-borne diseases often face difficulty in obtaining insurance coverage or disability pay. They talked about the effect of tick-borne diseases on their livelihoods, on their relationships, on their employment. We had a number of people wrote in talking about how they had to retire early, or they had to change jobs, or they had to move to seek care. We had people who talked about the effect on their health and their ability to carry out the hobbies and things that make them happy. And so we heard a lot about personal sacrifice and loss throughout these comments. Next slide. Another significant theme was mental health. This is one where people talked about the significant impact that this had on their mental health. They talked about depression, anxiety. Some people talked about suicide. People talked about deaths of family members and friends that were either directly or indirectly related to tick-borne disease. And I think we heard some of the comments today that this is something that is significantly impacting the quality of life of people who have tick-borne disease. Next slide. Mishandling was another theme that wasn't typically a top 3 theme, but it did rise to some prominence. A lot of commenters felt as though the federal government has not properly responded to tick-borne disease, or they feel as though it's an underfunded or neglected disease. They feel as though that specifically Lyme has been dismissed, or it hasn't been properly funded for research or purposes of insurance claims and whatnot. So this is a theme that came up quite a bit. Next slide. And then finally, we did have a significant portion of emails that addressed vaccines. And I wanted to acknowledge that this is not something that's easily separated into pro and con categories, because there were a lot of issues within these emails and comments, and it's a very nuanced issue. But some of the things that were brought up was especially on those who felt very positively about vaccines, the cost-effective nature of those vaccines, and how they could be used as a significant tool in the fight against tick-borne disease. We also had people who brought up issues of safety, wanting to make sure that they were properly evaluated. And then on the negative side, we had people who distrusted vaccines. We had people who were skeptical of them, especially in light of previous vaccines that have been approved for use in the United States, and people who expressed significant safety concerns. And next slide. So that concludes my presentation. I'd be happy to answer any questions. Thanks.
Thanks so much, Lauren, and thanks for all the work you did trying to organize this and present it so clearly. For anybody who has questions, please use the raise hand function, and we'll call on you in the order that that you raise your hand.
Great.
Jennifer.
Hi, Dr. Platt.
Thank you. I'm kind of laughing because I was actually on this subcommittee, and I don't remember asking this question before, but thank you for the very excellent presentation. One thing I'm wondering is, and maybe we'll do this more as we get further into the 3rd round of the report, but would we be able to look at the evolution of changes and themes and comments over the 4+ years now that we've been meeting?
Yeah, absolutely. We did code for the various cycles, so we can separate each of those themes by the cycles that they were received in. So absolutely, as we continue to work on the report to Congress, we can certainly include that specifically.
Yeah, thank you. I think that would be really beneficial, and just curious to see if it's changed, how it's changed.
Great, thanks so much.
Lauren, I just want to say thank you too. I was on the subcommittee with you, and you just put it all of these comments that we all read. It was just so well done to really just see what the public is feeling. So thank you so much. We so appreciate it.
Likewise, Holiday, I really appreciate that.